increase in air travel, a lot of physicians are called upon while they're traveling to participate in any kind of in-flight emergencies. Big conditions that we all worry about is, of course, cardiac arrest, stroke or syncope, and respiratory issues as well. And now, one of the studies that was done back in 2013 and published in New England Journal of Medicine did show that overall incidence of in-flight emergencies is 1 per 604 flights. And out of those, the majority of the in-flight emergencies were either syncope or pre-syncope, followed by respiratory illnesses. 48% of them were attended by physician passengers, and almost 7% of the flights were diverted to a different airport. Normally, airlines would fly at about 30,000 feet. Of course, that is not conducive to normal health. So there is about 25 to 30% expansion in the gas in any cavity that is enclosed, as per Boyle's law. So if you have a patient who has cystic lung diseases, these cysts, if they're not communicating with the tracheobronchial tree, this cyst can expand by about 25 to 30%, and if they're thin-walled, they can rupture and cause pneumothorax, and that's where the problem lies. It is important for us to recognize that patients who have cystic lung disease and they are traveling, they are at a slightly higher risk than people who do not have cystic lung disease, and that's where the talk went. In the medical kit, there are a lot of helpful things that you can look at. So there's of course IVs, needles, there's a tracheal catheter, and other things that can certainly be very helpful in in-flight emergencies. Again, this has to be coordinated with ground-based medical specialists that your pilot will call. You have to remember that the responsibility of patient care lies with the airline crew, and whether to divert the flight or not depends on the pilot, and all of that has to be done in conjunction and consultation with ground-based medical staff. But you can definitely provide your expert opinion. Best thing is if you're called upon, you go introduce yourself. Tell them about your specialty. Maybe this is not your specialty, but your medical background can actually help the ground-based medical staff in deciding what to do. One of the big questions that people have is what about medical legal risks? For all practical purposes, Good Samaritan law applies to it, provided you have not actively harmed the patient by wrong decision making. So if you are working with the cabin crew, pilot, and ground-based medical staff, you should be okay. There are certain countries in Europe that in fact mandate that you participate in taking care of the patient, and if you don't, then that's another problem. But for all practical purposes, if you do find yourself in that situation, please make sure that you work with the cabin crew, pilot, and ground-based medical staff.